First of all, thank you all for being here. This is a really fantastic opportunity to learn from three amazing, amazing leaders from the psychology department at McGill University. Thank you all for taking part in McGill homecoming activities, for your presence here, and also for staying connected to the university. Bonjour à tous, c'est un réel plaisir pour moi de rejoindre à vous aujourd'hui. My name is Inez Jabal-Perwala, and I'm a three-time alumni of the university and past president of the McGill Alumni Association. I, in my current role, also represent the MAA as an alumni governor on the Board of Governors of McGill. So I'm a huge fan of McGill University. I've stayed engaged since I graduated, and it's given me more joy and fulfillment than I can express in this short time, but just a wonderful community and place of meeting. It's my pleasure to be the MC this afternoon for this series of masterclasses which are taking place. And whether you participate and attend one or two or all three of these, I know that you're going to leave being inspired and enriched by the discussions that we'll be having. So without further ado, I'll be introducing our three guest speakers for this afternoon's first session. These are all esteemed professors at McGill University, and the masterclass is entitled Understanding Youth Mental Health, What the Data Really Says. Dr. Anna Weinberg is a Canada Research Chair in Clinical Neuroscience. She investigates the biological pathways that underlie emotional disorders with a focus on identifying who is most at risk for developing anxiety and depression, particularly during adolescence. Dr. Melanie Dirks is the chair at McGill's Psychology Department and Chief Scientific Officer of CARL AI, which is Quality Assurance Response Liaison. A clinical and developmental psychologist, her research explores how young people build and maintain healthy peer relationships and how these relationships influence mental health. Dr. Dirks' insights are essential to understanding how changing social dynamics, both online and offline, shape youth well-being. Dr. Sarah Colalito is director of the Virginia I. Douglas Center for Clinical Psychology at McGill. She's a clinical psychologist whose focus is on child and adolescent mental health. The Center for Clinical Psychology provides training for graduate students in the application of evidence-based assessment and intervention techniques. It also provides affordable psychological services. Welcome to all three, and now it's going to be over to you.
Thank you very much. So I'm Melanie Dirks, and I am the chair of the McGill Psychology Department. Also, full disclosure, I don't think I've ever given a talk with a mic like this. So it's going to take me a minute maybe to adjust to it. It is, of course, a great privilege to be the chair of the Psychology Department at McGill, in part because of our outstanding history. So we are, in fact, the oldest psychology department in Canada, celebrating our 101st birthday this year. But also because of the amazing work that's going on right now. And the best thing for me about being chair is when I have questions about psychology, which I often do, I have an incredible roster of experts to who I can turn. And so that's why when I started seeing headlines like these cropping up in basically every major media outlet, so the New Yorker, that's clearly the New York Times from that font, there's the New Yorker, The Atlantic, I started to wonder what's really going on. And Anna and Sarah and I started having a conversation in which what we really wanted to do was fact check this. So if we actually look at the data, because these are empirical questions, so if we actually look at the data, are the data telling us a story that's consistent with these really alarming headlines? So what we're gonna do today is have this conversation with you. And what we're gonna do is we're first gonna talk about what are we talking about when we talk about mental health? How has youth mental health changed over time? So when we, again, actually look at data, what does it tell us? And what role might technology and social media play in those changes in youth mental health? But I thought I should probably begin at the beginning and tell you what I mean when I'm talking about youth. So over the last 30 years, we've really seen the boundaries of adolescence, or what people think of as adolescence, get pushed out both sides. So we now think of early adolescence as starting at around age 10, and that's in part because we've seen a lowering of the age at which most people go through puberty. And we've also seen people push it up on the top end, and that's because we know that the brain continues to develop in important ways all the way through age 24, 25. So when we talk about youth, we're talking about people who are aged 10 to 24 or 25. So when I talk about mental health, what am I talking about? So mental health, very broadly, refers to people's psychological, emotional, and social well-being. That is a giant umbrella that covers a huge number of things, all the way from feeling lonely to suffering with a very significant thought disorder like schizophrenia. So for today, just in the interest of time, we're going to focus on talking about anxiety and depression. So anxiety is feelings of worry or fear. Depression is feelings of sadness or loss of pleasure. And when scientists think about anxiety and depression, they tend to think about it in one of two ways. So they either think about it in terms of presence of symptoms. So does somebody feel sad? Does somebody report that they're feeling worried or they're feeling anxious? Or they might think about it as an actual clinical diagnosis. So now we've moved from thinking about one symptom to thinking about a pattern of symptoms. So for somebody to be diagnosed with major depression, they need to report that they're feeling very sad or that they're feeling loss of pleasure, but they also need to report at least 4 other symptoms. So things like having difficulty sleeping, having difficulty concentrating, or making decisions. And it's also got to be associated with significant impairment and distress for the person. It's getting in the way. They can't do what they want to do. They're not living the life that they want to be living because they're experiencing these symptoms. So I want you to keep that in your head, and I want you to keep it in your head past this talk, because whenever I see headlines like that, the ones I showed you at the beginning, literally the first thing I think is how'd they measure that? Because how you measure it is going to change the answer that you get. So I'm going to start by showing you data from studies that have looked at changes in symptoms over time. So this is data from the Centers for Disease Control in the United States that were published in 2023. And I would call the drop of these data actually explosive. So I had more conversations with people about these data than I think about anything else that went into the media. And so these data are showing you how many youth, what percentage of youth reported a symptom of depression. So had they experienced significant sadness for a period of about 2 weeks in the past year. And what caught people's attention was in 2013, so here, about 39% of girls reported that yes, they'd experienced that in the past year, and 21% of boys reported it. When we get up to 23, it is now 53% of girls reporting that they've experienced significant sadness in the last year, and 28% of boys. So that is up from 2013 to 2023. So this is a similar approach to looking at anxiety now instead of depression. So now adolescents are being asked, have you experienced significant worry or fear in the last year? And we're seeing the same general trend. So 40% of girls in 2012, where's my 40% of girls in 2012 up to pushing up around 50 in 2018, and then again a little bit up for the boys. So those are symptoms. What happens if instead of looking at a symptom, we look at a diagnosis? So now again, it's not enough to report one symptom, you've got to have that whole pattern. So this is showing you the percentage of teen girls and teen boys who now meet criteria for a diagnosis of major depression. Again, as a function of time. So in 2009, it's about 4% of boys and about 12% of girls. And by the time we get to 2019, it's about 20% of girls and about 6% of the boys. So it's fewer than we saw in the previous slide because now we're setting a higher threshold. We're saying that there has to be a diagnosis present. But as a clinician, I'm concerned about those numbers. And we're seeing the same trend. The trend is up. So we are seeing, consistent with the headlines are reporting, we are seeing a significant increase in youth mental health problems over time. So just by purpose of comparison, this figure is showing you adults. So this is the prevalence, or this is the percentage of adults who meet criteria for major depressive disorder over roughly the same period. So going from 2007, 2008 to 2015, 2016. So adults are not showing. So these are adults 20 years and up, and they are not showing the same increase that we are seeing for the teens. So I'm going to turn it over to Sarah, who's going to tell us a little bit. You can,
Sure.
Yeah.
Okay, so I'm going to talk a bit about, well, add to what Melanie has been sharing about changes in youth mental health over time and talk specifically about the pandemic. So, of course, rates have been increasing, as we've just seen, before the pandemic. And after the pandemic, which was, you know, this major global social health event, it seems to have gotten worse. So we have seen increases in, subsequent increases in mental health problems in young people. And this makes sense. You know, we were all there. The pandemic kind of sucked. There was increases in social isolation, loneliness, large increases in just like general uncertainty about what was going to happen in the future, how long this would last, when we would, when it would be over, when we'd have a vaccine. Lots of unknowns that was contributing to just general stress for both adults and young people. Also, huge losses of life. And we see these effects in Canada especially, so not especially, but of course. So data from the Children's Hospital of Eastern Ontario, data from the Centre for Addiction and Mental Health show that young people, this includes young adults also, so teenagers and young people have reported more mental health symptoms or a deterioration in their mental health during the pandemic. And what we also know is that this seems to have been especially pronounced for people with existing vulnerabilities, so pre-existing mental health conditions and other risk factors like living in a northern rural community or being low income. To bring this a bit closer to home, in Quebec, we saw, across Canada and in Quebec, for example, at the Montreal Children's Hospital, we saw large increases in mental health-related emergency room visits. At Saint-Justine, their wait list for people, young people waiting for psychosocial services increased by like 325% from the years 2020 to 2023. So this is, a huge problem, and there seems to be, whether or not we're measuring it better or these are like real increases in mental health problems in young people is a huge concern.
Okay. So the situation definitely worsened in the pandemic, but if you think about those figures I showed you, we were on an uptrend before we got to the pandemic. And so the question really is, why? What happened? And one of the things that has caught a lot of attention, both in the public press and among academics, is that trajectory, that increase that we're seeing in anxiety and depression, tracks with the rise of the smartphone. So it is actually hard for me to believe at this point that it has only been 18 years since Steve Jobs and his black turtleneck got on stage at the Moscone Center in San Francisco and showed the world the first iPhone in 2007. And by 2010, they had moved on to the iPhone 4, which was notable because the iPhone 4 was the first one that had the front-facing camera, which facilitated making video calls. And it turned out, it's hard for me to believe that it was only 18 years ago because phones are so ubiquitous now. Everyone's got one. Some of you might be on them. Everyone's got them, and they're so integrated into our lives. And in fact, if you track people's sort of adoption of the phone, you can see first ones introduced in 2007. Within less than a decade, 73% of American youth report they've got access to a smartphone. And by 2023, it's basically all of them. So 95% of US youth report having access to a smartphone. Of course, they have access to other technology too. Most American youth also have access to a computer, to a gaming console, and to a tablet. And with that spread of technology has come increased connectivity. So in 2015, when Pew asked American youth, "Are you online constantly?" only 24% of them said, "Yes, I am online constantly." By the time we get to 2023, now nearly half of them, 48%, are saying, "I'm online constantly." So what are they doing online? Well, they're spending a fair amount of their time on social media. So social media, again, somewhat unbelievably, really began in 2006 when Facebook became available to everyone who had a valid email address. So prior to that, it was called the Facebook, and it was only available to people with Ivy League email addresses. But in 2006, it became widely available. 2010 brings Instagram, 2012 brings Snapchat. And by 2015, Insta has 400 million active monthly users. Snap has 86 million daily users. In 2018, TikTok was introduced in North America and basically immediately had 271 million monthly users. So by last year, Insta, 3 billion monthly users, Snap, 453 million daily users, TikTok, 1.6 billion daily users. Teens spend a huge amount of time on these platforms. And we're not even mentioning YouTube, which is actually the platform that teens say they spend the most time on. So 71% of American teens say they're on YouTube at least once a day. Okay, so we're seeing this rise in smartphone technology and in use of social media. So what role might that be playing in symptoms?
Okay, so I'm going to take over now presenting some of the data on this because the data are certainly not reflecting what we are seeing in those really alarming headlines. So there is no doubt that technology and social media have made an impact on youth's lives, on all of our lives, or in most of our lives. So this is true of adults as well. Kids are, as we have seen, spending more time on screens, and they're doing different things on screens often than adults are, which is a really interesting question that's a little bit underexplored. And there is some evidence that associated with this is reduced time doing other things, and the one that I think we all find the most alarming is reduced time with sleep. So as parents of teenagers, sleep is a real obsession of mine, I know of yours as
Yes.
well, because sleep more than anything else seems to be a really powerful predictor of lots of different forms of psychopathology. And so if social media is replacing sleep, in some instances it is, that to me is one of the more alarming possibilities. We also know that a lot of people's interactions now with their peers, with their classmates, are occurring through technology, but not exclusively. So again, this gets overstated a bit. So certainly there is more interaction through technology, but kids are still going to school in person. Kids are still interacting with other kids in the classroom, on the playground, on the way to school. Sometimes that is a bit mediated by technology, but it's not exclusively online. So then what do we see? And so I will say that in all of the meta-analyses that we've looked at, we do see some significant associations between greater use of social media, greater use of smartphones, and symptoms of anxiety and depression. So we do see some. It depends a lot in the literature on how you're measuring it, what covariates go into the model, so what else you put into your analyses, but there are some significant associations, which means broadly, just to explain correlation, although maybe most of you won't need this, that as social media use increases, so as people report that they're using more social media, we also see some increases in anxiety and depression. But those associations are small and much, much smaller than, again, those headlines would have us think about. So this is a study from Orban and Shabilsky in 2019, where they did a meta-analysis. So I have it in my notes, but I can't remember the total number. It was about 350,000 youth were included in these analyses, where they're looking at the associations between time spent in social media activities and well-being. Pretty broadly defined here, but this includes anxiety and depression. So first, you do see a slight negative association between digital technology use and well-being. So as digital technology use increases, well-being decreases. But I want to show you or just point out the magnitude of that effect, if I can, here. So it's negative 0.05, that's a standardized regression coefficient. What that essentially means is that about 95% of the variance in anxiety and depression or in well-being is not explained by social media use. So the vast majority of this kind of variability in these outcomes is not associated with digital technology use. So contrast that with things like being bullied, which we've known for a long time is really bad, of course, for youth mental health. So that's the magnitude of being bullied. Here's the magnitude of engaging in binge drinking. So you can see that use of digital technology and social media does not even approach these things that we know are associated pretty strongly with negative outcomes for kids. What it does compare more closely to are eating vegetables. So eating more vegetables is also associated with slightly decreased well-being in adolescents. Eating potatoes has a nearly identical effect size to using digital technology. So this is important because, well, we were talking about this. No one, to my knowledge, is legislating or proposing legislation around eating potatoes, and they can pry them out of my cold, dead hands before they get rid of potatoes. And wearing glasses is a little bit stronger, that association. So when we're talking about this negative effect, that's really the magnitude of the effect that we're talking about. It is slightly negative, but it is comparable to other things that we don't think of as really hugely detrimental to youth mental health. The other problem that we have is it's not clear. These are cross-sectional associations, right? So they're measuring the two things at the same time. It's a correlation. It's not clear what is driving what. So this is our annual reminder. Correlation is not causation. Two variables, two things can change in similar ways at the same time, not because one thing is causing the other, right? So we do not think that although ice cream sales and shark attacks increase over the same period of time, and you see them rising and falling together, we do not believe that ice cream sales drive shark attacks, or vice versa. So what could be going on here? So it is possible, of course, if we're thinking about correlation, when we see these cross-sectional associations, it's possible that social media use is driving decreases in well-being. It's also possible that kids who are lower in well-being use social media more and maybe use it differently than kids who are higher in well-being. It's also possible that a third variable is driving the increase in both, or the change in both, as we saw with the onset of summer, driving both ice cream sales and shark attacks. And then, particularly when we're looking at associations that small, another possibility is just chance, that these two things rise in the same way that eating potatoes and well-being rise. There's an association just by chance because we have so many people in our sample. But the story we're consistently being told in the media is that this is what's going on, that these kind of technology companies are blithely ignoring the toxic effect that they're having on well-being for adolescents. So let's think about what we would need to see to believe that to be true. So the correlation, the cross-sectional associations, that doesn't prove it. What might convince us? So one thing that you might want to see is a temporal precedent, right? So that the increase in social media comes before the increase in anxiety and depression. So there have been a lot of studies, well, actually haven't been enough studies done on this. There have been a few studies done on this, and they tend to tell a really consistent story, which is something like this nice study from Heffer et al. In 2019, where they look over time at what predicts what. And they did this in adolescents, boys and girls, and they did it in young adults, men and women. And what they find is that only for adolescent females, it is not the case that social media consumption at time 1 predicted increases in depressive symptoms at time 2. Instead, what they find is that those girls who are showing more symptoms of depression at time 1, they increase their social media use over time. And, and that's even controlling for how much they're using it at baseline. And so this pattern shows up a lot in our data, which is that kids who are more depressed and anxious, they use social media in a different way, and they tend to use it more. And that may exacerbate their symptoms over time, but we really have very little convincing data that social media causes increases in depression and anxiety over time. Another way that we could be convinced that this causes this is to manipulate our independent variable, right? So we can change social media uses. If this causes this, changing this should change this. What do we see? So this is a recent meta-analysis of a bunch of different studies where they asked typically young adults here. I don't know of any studies that have done this with adolescents, but they asked young adults to abstain from social media usage. And that was supposed to be totally abstain, so go off of social media for variable amounts of time in the different studies. So sometimes it was 7 days, sometimes it was a month. One of the funniest things of this meta-analysis is how poor the adherence was to that mandate. So many of these young adults reported, I couldn't do it, I couldn't stay off of social media for the whole time. But they all reported a significant decrease in the amount of social media they were consuming. So this is telling, they're changing how much people are using. And what we see is there's no effect, essentially. Across all of these studies, if you look at the meta-analysis, the average effect size is really beautifully right on zero, meaning we see no association between changing social media use and outcomes for these young adults. So it's really not clear here that technology use drives these increases that we're seeing. And the associations.
Yes. So the last data point we want to make is that often when people are reporting, they're telling you about the average, right? So the figure Anna showed you with the potatoes, this is all I'm going to remember about that figure, is showing you the average association. But that average is based on lots of individual people. And you may remember from your intro to statistics class that we don't just care about where the middle of the data are, we care about the distribution around it. And often you need to see that distribution to really understand what's going on. So I'll give you an example, which is a study I really like that was done by a team in the Netherlands. And they were interested in understanding how use of social media like Instagram might be related to how close they felt to their friends. And so what they did is they would contact teens at random times during the day, and they would ask them questions like, how close do you feel to your friends right now? Did you connect with your friends in the last hour on Insta? So I'm going to show you a figure from their data, and I'm going to explain the figure to you. So what they're interested in is the association between whether or not you spoke to your friends on Insta and how close you feel to them. And as Anna described, that association can go from -1 up through to +1. And the black line is showing you the average effect in this group, and it's a little bit negative. So on average, people felt a little bit less close to their friends, even though they had just connected to them on the last hour on Insta. Again, like all the effects Anna showed you, it is small, right? It's barely below 0. So what this figure is actually showing you is how many participants have each effect size. So if you look here, this is showing you that about 60 participants have an effect size that's between 0 and 0.1, and the next bar was showing you that about another 60 have between 0.1 and 0.2. So when you look at the figure, what you can see is, yes, there's the average, but look at the spread. About half the kids actually have a positive association between connecting with their friends on Insta and feeling closer to them. And so what that's telling us is two things. One, you're probably going to get differences depending on what kids are doing on social media. And two, there's going to be differences for different kids. Some kids are going to be more vulnerable and more at risk when they're using social media. And for other kids, it actually might be a very positive way to engage with their peers. And so these stories just about the average are not telling us about the experiences of all adolescents. All right, and we will turn it back to Sarah.
Okay, so I will hopefully illustrate what some of those experiences are just of adolescence, just based on my work with young people. And I'm going to stay seating this time because it's more comfortable. Okay, so pretty much all youth use social media. This is ubiquitous. And using social media is not inherently beneficial or inherently harmful to young people, as we've seen, or at least young people don't experience universally positive or negative effects from social media. So I will talk about, in practice, some of the risks we see associated with social media. And again, like, this does not apply to every single young person that walks through your door. When we, as clinicians, we are focused on the individual in front of us, less so on the averages that we see in, like, in the population, but on the person in front of you and what are their unique set of circumstances and characteristics, one of which is how they use social media. So I teach my students to routinely ask about social media in their intake interviews. You know, if I have a teenager in front of me, do you use social media? What social media platforms do you use? How do you use them? Do you share content? Do you post content? How often do you use social media? Is social media related, do you think, to the problem that you're coming to therapy for? And you can get any number of answers, and that will inform how you're going to work with this person. And so clinicians and, you know, parents, caregivers, family members should be more curious rather than accusatory or blaming of social media for causing any problem. But you want to be communicating openly about these things, so having open-ended conversations. Now, some of the risks associated with social media. Anna talked about decreased sleep. We do see this. So some families, some young people will acknowledge themselves that they get less sleep because they're on their phones late at night or on some type of screen, even beyond social media, just engaging in any type of like digital media use that can impact their sleep. So if this is the case with the person that you're working with, you might try to collaborate with them and develop ideas for how you could change that. Maybe with younger people especially, we're working with caregivers to try to set limits or guidelines, maybe you know, no phones beyond a certain time, to kind of try to minimize the negative impact that this can have on young people's sleep. Relatedly, it can also disrupt other activities. The number one, well, I think in my practice, the number one thing I hear is disruption of homework and getting really, really distracted by social media or you know, receiving texts that are kind of distracting people from completing their homework. Especially true, I would say, again, for more vulnerable groups, right? People who have ADHD, I hear this a lot. People who just would struggle otherwise with focus and are more prone to being distractible, this might have a bigger impact on them. So we're working with young people on finding ways that they can try to regulate their smartphone or social media use by maybe having it somewhere or, you know, allowing them, you know, maybe 15 or 20 minutes to catch up on things after school and to catch up on, you know, their social networks after school, and then putting the phone away for X number of time. I just discovered this really cool app that one of my clients told me about, where you can like book a flight from one destination to another, and then you're sort of working through the flight time. And then once you've landed at your destination, you can, you know, go back to resume whatever you're doing. Anyway, I thought that was really cool and seemed to really work well for this particular client. She brought it to me. The other very real risk is cyberbullying and victimization. So this does happen in extreme cases. You know, you hear about like sextortion, and none of us are denying that that's a problem. It is really scary. It is definitely a possibility. It means that we need better regulation of social media, and you know, as we would recommend to parents of kids who are being bullied, who may be bullied in their offline worlds in real life, you know, just trying to be very open and curious about kids' offline and online worlds to try to mitigate some of these effects. Harmful content, again, that could be available on social media. You know, for better and for worse, young people now are way more aware of and have much more information, both accurate and inaccurate, about mental health and diagnoses. And so they're coming in with a lot of ideas already about what could be happening to them, what, you know, would be helpful or not helpful. And so it's really important as clinicians to be digging deeper and figuring out, like, okay, what do these terms mean to you? When you say you're depressed, like, what does that mean? Often it will equate to boredom, interestingly, what I'm seeing. So, okay, talking about things, making sure that young people can evaluate the information that they're coming across online. So if it's something related to mental health, you know, who is posting this? Is this someone who is credible? Is it a psychologist or another kind of mental health professional? Or is it another teen speaking from personal experience to try to help them be more literate and evaluate what they're seeing?
Sorry.
Time? Okay, last slide. I'm going to talk about some of the benefits. Okay. By and large, I would say most of the people that I work with, it's more common to hear about the benefits of social media than it is to hear about some of the downsides. So people use it as a way to connect. People use it as a way to stay connected with their friends who have since moved away. I have a current client whose best friend is in Las Vegas, and so this is how they communicate and can maintain their friendships. Sharing content, sharing memes, sharing funny videos. This is also how parents can connect with their kids through social media. Lots of people can now access supports through social media. Before social media, it was really hard to have like firsthand, you know, advice from a professional. And now many esteemed psychologists and other mental health professionals have social media accounts and disseminate lots of great information that people were not able to access otherwise. So that's great. Lots of people report that this was sort of their gateway into seeking further help for their existing mental health problems because they heard something helpful on social media and they wanted more. Affect-enhancing content, so I talked about funny memes and funny videos. We also integrate this often into safety plans for suicidal individuals. So that's not to say, again, it's very nuanced. It's not to say that we recommend, you know, anyone or any teenager who's experiencing an uncomfortable emotion, kind of just go and watch a video and that'll cure everything. But in moments of really heightened distress, it can be a saving grace. And so we leverage that. Okay. I'm gonna stop. Yeah.
No, but I think
Sorry.
I think it is.
I'm excited about it.
No, because I think it's actually, we hear so much about what's bad about social media that I think it is really important to highlight the ways in which it actually can be helpful and the ways in which we can leverage it to actually make things more positive for the youth in our lives. So just to briefly wrap up, the data tell us that, in fact, youth mental health problems have increased over the past 15 years. We know that some youth are engaging with technology and social media in ways that are harmful for them. Again, it is not clear that engaging with social media and with smartphones is driving those increases anxiety and depression that we're seeing. And again, we want to highlight that technology and social media may also confer benefits for youth. It's also important to remember that so much attention is being focused on social media and on technology now that people are not thinking about anything else. But as Anna showed you, 5% of the variance, that's what you're getting from social media and from technology use. That leaves 95%, right, that we could also be getting leverage on, and we need to start thinking about other types of change and other ways in which we can support youth. And ultimately, what we need to make sure is that youth have the ability to access high-quality mental health services, because right now it is next to impossible for a child or an adolescent who is struggling with clinically significant anxiety or depression to get help. And this is a tragedy, because a thing that the data also tell us is we have extremely effective treatments for youth anxiety and for youth depression. And the earlier we intervene, the better the outcomes are going to be. So we can actually make a difference in the lives of these kids if they can get to us. So we will wrap there. And I'm sorry, we have run long, but we do have, I think, some time for questions.